Staffing problems at some health facilities could worsen if vaccine requirements for travel nurses continue. That's according to staffing agency Dakota Travel Nurses, a major supplier of nurses to facilities across North Dakota. Kamini Amanor has more on the hesitancy to get vaccinated and why.
As COVID-19 cases continue to surge in the state, the demand for healthcare workers, particularly nurses, is also climbing. But meeting this demand is proving difficult because of vaccine requirements. That's because some nurses, like Sadie Hawes, are not willing to take the COVID vaccine.
I don't think it's fair. I don't believe that they are listening to the nurses and listening to it's very interesting that a lot of us, including myself, in the healthcare, but more specifically in long-term care, there's a lot of us very hesitant about the vaccine, and that should say something.
Hawes adds up to 30 to 40% of the travel nurse population that will not take the jab. CEO of Dakota Travel Nurses fears nursing shortages and burnouts could only worsen.
We have done a lot of communicating with our nursing homes across the state, and some have made it very clear if this vaccine mandate does go through that they will have to shut their doors, because it would not be, if we're going to be losing 30 to 40% of our staff and they're losing 30 to 40% of their staff, that is not a good situation for the residents and getting the care that they need.
Hawes, who's based in Munden, has been active for 12 years now. She worries that could have dire consequences for patients and residents who require their services to live comfortably.
We are already in a nursing shortage. And so for people with the power to not listen to our hesitancy and not accept our exemptions, the residents are, and the patients, because not just the nursing homes, they are the ones that are really going to be hurting. And that's what I'm most concerned about.
Right now, nurses are allowed to decline the vaccine on religious or medical grounds, and the president of the North Dakota Nurses Association says that's enough flexibility.
There's no doubt that nurses that just straight up don't believe in it or don't want to get it, they're going to end up quitting the practice. And that's heartbreaking for nurses. It's heartbreaking for our communities because there's no secret that we've had a shortage of nurses in our state for a long time. And will this add to that problem? It will. We know that. However, I think it's just one of those things that we're going to have to work through. We'll have to bring in more travelers, and we'll have to think outside the box to get through this crisis.
Data from the Department of Health shows there are about 113 positive COVID cases between staff and residents of long-term care facilities. Nurses who are refusing the vaccine want facilities to rethink vaccine requirements, not only for the nurses, but for their residents who need them. Kamini Amanor for KX News in Minot.
All three we spoke with today say they're hoping the state comes up with a solution soon that works for everyone.